let's begin. I just want to say one thing. You can go to the next slide, and that's the Remy laser. It's actually based on my Yorkshire Terrier, who's sitting right next to me right now, because my Yorkie is 4 pounds. The Remy's about 4 pounds. It's very powerful, and it's multifunctional laser, and it meets the criteria that's been very important to me over the last 14 years. And it's actually less than 14. Uh, 2007 is when I started. So if you think the numbers are off, but first of all, a laser must be effective. The second thing is it must be affordable to the patient. And the third thing is you can't spend 2 years, um, trying to get a return on investment in laser. It should be very, very quickly. There's well over 100 Remy's in a little over the last year that are out in the market. I won't mention names, but if you look at my website, you'll see the testimonials. I've even gotten some really, really well-known people in the field that are going to help me expand. I have one doctor. I haven't asked, he probably wouldn't mind me mentioning his name. His name's Dr. Barrett, and we're working on neuropathy. We have neuropathy protocols, but I don't want to. I want to stick to what we're going to talk about today because I think most people saw the micro drilling. I'm going to go over the basics of the Remy and what it does. Again, it's multifunctional. Okay, next slide. Well, now let's talk about this one thing because there's one thing, and I just added this. One thing about these slides, they've all been put together, and some of them may not be really specific and pertaining, and they're past ideas which I had years ago, and we've moved forward with them. But I kind of try to get an idea of why the Remy can do what we've done in the past. It can do what we do now in the future. And one thing that's interesting is there is I don't know if the word's controversial, but different opinions of using very low power versus class 4 high power. I personally like class 4 high power, and you'll see why. But the Remy can do it all. It can go from 0.1 watts up to 30. It can run on CW. It can run on pulse. It's FDA cleared for micro drilling, which is incision, excision. It can also do surgical, non-surgical warts. It could do fungus toenails, which we'll talk about, and I'll give you my honest opinion on that. And it can do almost anything you want. It even with the warts, it's insurance covered. So you have a mixing. Go to the next slide. A mixing of insurance covered versus self-pay. So therapy lasers. That's my what I think is the number one reason why you should get a laser. You should never buy a laser that just does one thing. It needs to be multi-function so it can bring in multi-revenue, and it's one laser that can move around. My first laser cost $36,000, and I only did warts in 1994. So therapy lasers stimulate cell function. It's a photochemical and not thermo, but the Remy does have a surgical aspect of it, which is thermo. So it's a surgical laser and also a therapeutic laser. And the word photobiomodulation is key. It's the chemical reaction of light going into the cells to stimulate a cascade, next slide, of healing events. Now, do lasers work for pain we're talking about right now? Absolutely. This is just one meta-analysis of the effectiveness of a therapy laser, including the Remy. I mean, I've been using this for well over 10 years, and the results are amazing. There's even articles, which I'd be very happy to send you, I don't have them included in here, talking about how they are very effective in the acute, anything that has inflammation, the Remy is going to work on and work well. Next slide. This is going to be recorded, so you don't need to take notes. You're going to get a copy of this afterwards, everybody, so don't worry about it. Just get what you can out of it. And my goal is just to give you as much. It's a very short period of time that we have to do this. So the biological effect of therapy lasers, which is one of the aspects, again, it's therapy, pain and inflammation, surgery, fungus toenails, and the microdrilling. And it's just you can go to the next slide. There's many double-blind randomized placebo-controlled studies. The chromophore, which I'd be very happy to show you. I have very good articles on this, and more are coming out. When you stimulate the mitochondria, you incite the production of ATPs, and you need ATPs to kick off or kickstart the healing process, the repair process, the reduction of inflammation, all the biological cascade of events, which is next slide. And the wound aspect, again, there was a study done, which I'll be very happy to give it to you. Just have to email me and say, ask me for studies, and I'll give you some good articles to read. If you just Google, you'll get a lot. But I have some really good ones which you'll like, and they're very good. I mean, this is not something you see one, do one, teach one. It's an evolving field. I don't call this physical therapy. I call it physical medicine. The more you're willing to put the effort in this, the better your results. Wound care. It's just amazing for wound care. Next slide. There's a study by the Temple School of Podiatry, that's not Temple, Kent State now, talking about repairing of wounds and ulcers. Very good study, even venous ulcers. This is just one full example. And this slide, this is probably over 10 years of slide, showing just with it, and we use much different treatments, more wavelengths. This was a single wavelength. You can see just how shortly, and wound care, very briefly go over it. If you have an interest in it, I'm very willing to talk to you one-on-one and just the aspect, because again, the Remy has lots of aspects to it. It's just not one laser doing one thing, it's a multi-function laser. I always like people to get started with the pain, and then the fungus. And now we'll have the microdrilling. Next slide. We've been working with microdrilling. I've been working for years. We can go, I mean, you can talk about the wound healing. It's a lot of the studies were done on the back and the spine. There have been studies I can give you showing the more power, the faster the relief. But there are some people that really like low power. I personally don't like it. But it's based on your experience, and I've done more cases with high powered. But I'm gonna talk more about what's important in getting results. I'll talk about that very briefly when we talk about the WOW experience. You know, it's very good for post-operative. If you do get rid of the inflammation around the incisions, it'll get incisions to heal better with less scar tissue. So it's post-operative trauma. On the foot, what's real good is, of course, plantar fasciitis. Some people don't like injections. I'll talk about this really quickly, is that I want you to just think about this. Podiatry only sees for tendinopathy is about 9% of the whole population. We're podiatrists. We think we see everything, every plantar fascia case, every Achilles tendon, but we really don't. We only see 9%. I'd like to see of the total population. You got people not coming in. You got people that run to the drugstore, go to other allied professions, MDs, ortho, everybody. Why is that? When they go to a dentist, because dentistry is striving to get better results and pain-free results. And people don't necessarily like injections. You may think they do. A lot of people won't come because there's the fear of a needle. Can you imagine bringing in additional 1 or 2% of the population? I'm not saying get rid of all steroid injections, that's your choice, but they're getting less and less popular for other reasons. But can you imagine increasing just by word of mouth and results? I don't believe in newspaper advertising and rating. I don't believe in that. But if you can improve outcomes and improve the way they get the results, help getting much faster and effective. Again, the technology has to be effective, very effective, and laser therapy is very effective. I'll talk about fungus toenails and give you my honest opinion on that too. Next slide. All lasers aren't created equal. They have to stimulate tissue. Now, this is an old slide. It talks about physics. Next slide. It basically says you have to do continuous wave and pump as much energy as possible in there, and only continuous. The Remy can do continuous and pulsing. We have the two philosophies are, one is you put as much energy as you can into it, and eventually you'll get enough down into the tissue that's biostimulated. Another one is that you pulse it because you give the chance for the energy to be absorbed better. It's like waves hitting the beach. You can, if you keep pounding the beach with waves, the energy doesn't get absorbed, it reflects back. So the Remy can satisfy both hypotheses. I still teach CW. I think that gives you the best result, but you can basically, when you get involved with me, I will show you how to use, you can take any protocol and make it work, because it's all about, you can go to the next slide, it's all about getting the right amount of energy in the right area to kickstart photobiomodulation. And we'll talk more about this. We're talking about how this is where there is deflection and reflection. The Remy has multiple wavelengths, so it's able to, has very little heat. People used to be worried about a 980 wavelength, which is pretty standard. We have mixed. You can go single with the Remy. You can go double with the Remy. You can go 4-wave if you want it, but I only recommend 2. But the point I'm trying to make is that the Remy has the right wavelengths to do surgery and to get that deep penetration. And to be honest with you, in the foot and ankle, you don't really need that deep of a penetration. You don't need to spend $50,000 on a laser because they say it's deeper penetration. I'll show you the techniques. You can get perfect penetration. Remember, it's a skill, not hard, but if you understand the principles, and that's my goal to teach you the principles, you're going to get results with the Remy, whether you're using 20 watts or 15 watts. It's just getting enough energy in the right spot, and how to do that. I teach you how to do that with proper, the hand pieces with the Remy. They're so light, they're only 8 ounces, they can be pushed right down to the bone. So you don't have any problem with penetration. Fortunately, the foot and ankle, the Remy is used full body, but the foot and ankle is very easy to do that with. Next slide. So when you're doing continuous wave on a single 980, which you can do on the Remy only, you do get a lot of loss of energy. When you start, so you need to realize that you have to overcome that. So you have to get more energy into the area when you're using a single 980. But again, with the new handpieces with the Remy, it doesn't really matter. I can show you how to get around that. This slide again is 10 years old, but I like to bring it up. I've advanced because I've learned from other. The Remy, it was. My background is I've worked for Light Cure, I've worked with K-Laser, I've worked for a lot of companies, and I've taken the best they have and put it in the Remy. The Remy is very variable and very multi-function. Like I said, it has multiple wavelengths. You can dial in the power on each wavelength, do single, double. I'll show you why and when you should use them. I put my own protocols in there that I've used because I want to get results, fast results, and I'll talk about that later. Okay, next slide. Again, penetration is important. Power density is the key. It's the amount of energy in the area over time. And I'll show you, if you understand power density, you'll understand when I train you of how that's an important word. We have the wavelengths, but you need to get the right energy, and you can increase the power just by shortening the excursion of the wavelength or pushing it down a little more. I show you and I demonstrate it. We have special training sections. It's not hard, but if you understand it, again, this is physical medicine, and it's very important to understand biomechanics and be a good diagnostician. That's important. I can help you learn that, but that's very important. It's just not like doing ultrasound or Whirlpool. It's not physical therapy. We just throw modalities to the person. You can get rid of relief. As long as there's inflammation, you're going to get relief. Arthritis, it's amazing for. Okay, next slide. Again, important of power density. There is an on and off switch that I don't know what it is, what amount of energy it is, but after a certain amount of a dosage, it's sort of like antibiotics, IV antibiotics. You have to get a certain what's it called, the minimum concentration in the bloodstream to get to kill bacteria. If you underdose something, it's not going to kill bacteria. The same thing with this. If you don't have the proper power density, and you know that by clinical feedback, which I'll teach you. Next slide. Again, this talks about wavelength. The two, in my mind, we have a 4 wavelength Remy. It's no different price than the 2 wavelength, but I like the 980, because you look at 980, has a high analgesic effect, a great water absorption, and the 810, which is the lime, that is the best photobiomodulation. It goes right down to the mitochondria. So I like to blend them together, and that's really what is out there today, is blending. And the Remy, you can blend wavelengths and powers. Each wavelength can go up to 15 watts on the dual wave, which is important. I think 15 is great. I like it. That's a lot of power. You can go up to 30. The key with the 30 is it does have some, the higher the peak power, which is the 30 watts, you rarely go up to 30 watts. The most I would recommend is 20 watts CW, which is what I recommend. But if you're getting into pulsing, you'll do it. But the peak power is what helps with the penetration. But with the hand pieces, that's not a problem anymore at all. At all. Next slide. Again, 980, there's no heat with an 810. 810 and 808 are the same. You can move it slower over the skin. When you blend these together, you don't have to move it. A lot of people are moving the hand pieces real fast. You could slow it down. You can push down on it. You can put pressure. You can get deeper. You're going to get much more biostimulation. They both get biostimulation, and that's the key. Biostimulation is, again, what starts the cascade of events to get the reduce of pain, inflammation, etc. So it's less treatment time when you blend it too. And that's another thing. We started at 10 minutes. Once I show you the results and how you got to get it, and you understand how to increase the power density, once the pain's gone, which could be anywhere from 1 minute to 10 minutes, you're done. But we take step by step in the training with this. I mean, it's real quick because I don't want to avoid it. Is you palpate the area. Let's say it's the plantar medial insertion. You palpate it. It hurts. We all know that. And when you're done the treatment in 5 minutes, repalpate it. If there's no pain, you just turned on the biostimulation. So it's a clinical feedback with palpation. Just don't do the treatment and say, I'll see you, Mrs. Jones. You do it until the pain's gone. The less time you put into it, the better clinician you are, because you've put it in the right area and you've got the right power density. It's not hard to do, but there's a little bit of a learning curve. The worst that can happen is they don't get 100% relief the first visit, because you haven't hit the right areas, and you need to learn that. And it's just experience. The worst happens is, hey doc, I only got 50%. So you just give more treatments, and you may have to give a longer treatment time each session. But there's a lot of variables. It's very easy to be a very good laser clinician. It's be a great one. It takes a little bit of effort and a little bit of time. I have some great training tapes, which I talk about. And one thing with me is I don't really like selling lasers. I like to help you help your patients. And that's what's important. If you get good outcomes, a doctor say to me, I'll never forget as long as I live, I bought a laser like 40 years ago. And he said, what do you buy a laser for? He says, all you have to do is the best outcome and effort you can put into getting the best result. Lasers were not like they were today. I mean, the Remy's, the pricing of the Remy, because I'm a manufacturer, is well over 50% in the typical lasers out there. It's a better laser. There's no question in my mind it's a better laser. You're going to hear more and more about it. But anyway, I know you want to talk about the microdrilling, because that's what we talked about. So we're going to move this quickly to get to it. Next slide. But to me, pain. Now, this is an article. There was an Egyptian article talking about they only used a straight 810, which is what the Remy has. They got pretty good results. I had a clinician go out and look at the result, look at the article and talk about the 810 from he's an engineer. And this is, we concluded that the 810 could get just as good results as the 980. We've combined it. We're going to talk about the microdrilling, because I have a mobile company where we do laser and microdrilling, and the results are very, very good. They're not 100%. Anybody tells you they're getting 88% or this and that, it's not true. I always say it's between 50 and 70% success rate, especially when you combine. It could be higher when you combine the wavelengths, and with the microdrilling, it could be even higher. And the way I base it on is in our mobile group, I have doctors that keep setting up patients, and it's telling me they're getting results. I talk to a lot of doctors. Oh, I love this laser, it does great. And well, how many referrals you getting? To me, that's how you know you're doing well and you're getting results, is the referrals you're getting. I'm not talking about newspaper advertisement. A lot of doctors say, oh, I don't know. I once had, there's so many difficulties with fungus toenails. I would rather under-promise than over-promise with it. And it's not a monotherapy, it's multiple therapy. I do believe that if you added 1 week of Lamisil, it's just an option, your results are going to be better. So if you laser, microdrill, and if it's not doing well, you can add 1 week of Lamisil, and that could even improve it. But the goal is, I always used to tell patients, it's to eliminate or reduce tremendously the use of an oral medication, even less than pulsing. We're talking 1 week at times, but you're going to get some pretty good results just with the drilling and the laser. We're also working on photodynamic therapy, which is another topic. I have a podiatrist that's obsessed. His name's Neil Goldberg from Jersey, and he's doing all kinds of studies with me on the office. I want to thank him. I don't think he's on tonight, but I want to thank him because he did a lot of the testing of hand pieces for the Remy. I supplied him and he tested them out. And you'll hear more about him because he has a lot of experience in using topical medications. Apparently, biofilm, if that word means anything, is very important. It's what prevents wound care, healing, and killing of bacteria. But there's philosophies and hypotheses that believe that it's the biofilm. And I'll give you some of my reasons why microdrilling works too. Okay, next slide. The sponge, we can skip about the sponge theory. You're going to get copies if you want to look at it. How much is enough? It's amazing. You can put a lot of energy into the area, but you only need about 6 joules to get the biostimulation. They did studies on that. To me, it's when the pain is gone, you know you have enough energy in the area. So it's palpating the area and then repalpating it. At the pain, not 80%, but I'm talking about significantly or almost 100% gone. Then you know you got a result and you move on to the next treatment. Okay, next slide. We can skip this. Duty cycles. You know, it's interesting with the Remy. It has such high power density. You can use duty cycles, or you can go CW. Again, I like CW because it's just my experience. But there's a whole program you can do either or. That's one thing. It's not, you're not locked in with the Remy. You can go low power, medium power, high power. You can go CW pulsing. You can adjust the frequencies. Has a lot of versatility. If you see an article and you like the treatment, you can put it in the Remy. I prefer until I'm convinced that there's a better treatment. I personally like the 20 watts CW. I just like it, especially when you mix the wavelengths together. You're going to get what we call the wow experience, which is the pain is gone the first visit. Okay, next slide. Again, this is just showing the depth of penetration, how more significant the 810 is over the 980. It's much deeper because it goes right to the mitochondria. You have very little absorption in water and blood and skin. Next slide. Why do lasers fail? Just like why antibiotic therapy fails. You have under dosing, under penetration. You have to have the right amount, and it's power density, the right amount of dosing to get that photobiostimulation to work. And I still believe that with fungus toenails too, which we'll talk about. Okay, next slide. Okay, the keys to the outcome is to get its high power density. And you know, I'm going to change this a little bit. Is that we're always advancing. We have dual wave. This slide's well over 10 years. We didn't have dual wave. Now we have the 810, the 980. We have more wavelengths, but these are the two that have stood the test of time, and we've combined them. And results, I know from feedback, what doctors are saying about the Remy with the dual wave. And I got to tell you something. I just have the tip of the iceberg of testimonies. I've sold in the last year well over 100 Remys. So, and I've had people that have had it for close to 2 years. So it's not on the market just yesterday. It's always advancing. We're always adding. And one thing about the Remy is when we upgrade software and new things to it, it's available to you. Like our surgical handpiece, I'm making that even better to where you just can, and we'll talk about where you can just take the fibers and dispose of it. You have choices, and we can talk about that later. When you get the handpiece, I have the new handpiece, and you can use the old one. It depends on if you want a disposable fiber with it, which I recommend at this time. It's very inexpensive, and it's set. You don't have to strip it. You just put it in the handpiece, and you're ready to go. A lot of people don't have the time or the skill to strip it and prepare it. There's no preparation now with the new handpiece at all. You just put it in the fiber and go, and it's sterile. Okay, next slide. So we're always advancing, and you get all the advancements when they come out. So we can skip it, but why more power is better? Well, more power was better when you only had a 980 wavelength. Now you have dual, but you get the power. Again, the result is when the pain is gone, and you can get rid of it in the first visit. You just don't go. You have to know where you got to put it too. So you have to have the right diagnosis. Next slide. Okay, relief time with the Remy. Most patients walk in with plantar fasciitis. Let's say they have Lisfrank's arthritis or hallux limitus, neuromas. The one of the things amazing, if you just treat arthritis with the Remy, these patients are going to walk in, they're going to walk out with no pain. Can you imagine that? It's not like, well, you know, they're going to see the relief right then and there. You're not going to have to wait like 5, 6 treatments. They're going to see the relief. But the one thing I tell patients when they come in, we're going to get rid of the pain today, but you need to follow up with approximately 6 treatments to get it to heal. That's important. There's 2 parts, getting rid of the pain. Can you imagine when you present that to the patient and they see it, the more apt, the compliance is extremely high, extremely high. Okay, next slide. PT, why would you want to send out a patient for a plantar fasciitis or Achilles tendonitis or arthritis when you can do once a week for 6 weeks or twice a week for 3 weeks? These are the treatment sessions. It's much more affordable to the patient because deductibles and copays are very high. If you charge a treatment once a week for I'm picking $50. I mean, it could be $50 per treatment at a physical therapy. Plus physical therapy, ask your patients if it helps or is it comfortable. I'm not saying every patient should get laser versus physical therapy, but I want you to rethink it. Our goal is to make the patient happy and do well. And I got to tell you, laser therapy, they feel better right away. It increases range of motion almost immediately. You can show that right at the first visit. A lot of times a soft tissue equinus without any bony involvement, you'll get rid of it right then and there, and it's more cost effective. Plus the patient's there for 10 minutes. You know, we live in a very busy world. Good for post-operative, traumatic. I've treated many sprains and strains. I've worked in the NFL where we've used lasers, NHL where we've used lasers. And they use them. There's no reason why you can't. It's different. I mean, I'm giving you a conversation which was 10 years ago. Today, lasers are very popular out there. Almost a lot of people have them, but they're not affordable. My goal is to, like, again, get your lasers effective, affordable to the patient, and you need to make a fair profit. The average person will make at least $50,000 their first year. It's not a lot of money, but it's just the idea that you can give good care and effective care is going to increase your practice and who your practice is. Laser is a word that patients gives you a certain image, but it has to work, and this work does work. Next slide. What to look for. Again, this is an old slide. I didn't take it out. I'm gonna tell you, we used to say single wavelength. Single wavelength is better unless it's separate controls. The Remy has separate controls, okay? You can do, if you decide you want to pulse, you can pulse it. Sometimes different frequencies work better on patients in different cases, but I found the majority of patients with a protocol I've been using, the 20 watt CW works the best. It gets the quickest pain relief and resolution. But you know, everybody's different. You have that option. You're not cut off. If you want to do pulsing, when I worked for K-Laser, it was all pulsing. So I know pulsing. It can work if you know how to use it. I'll teach you how to use both, but I strongly recommend to start out with my protocols. They've been around for a long time. Okay, and the power. The Remy's 30 watts. You don't need more power in that than in the foot. Plenty of power. Next slide. Now, lasers and microdrilling for fungus. Next slide. I'm going to skip a lot of the pictures. I want to get into this. Okay, the onychomycosis or fungus toenails, the Remy is FDA cleared. All the lasers that are cleared for fungus, this is the definition. I don't like the definition, but that's what it is. Again, fungus toenails, there's a lot of factors with fungus toenails when you treat it, but you need to have options. Patients don't love orals, but you know, if you can reduce or eliminate the orals, sometimes you might need it, sometimes you may not need it. Some people throw everything at it, but I have found adding the micro drilling to the fungus toenail with the blended wavelengths makes a significant difference. I'm still going to stick it between 50 and 70% because you can have biomechanical involvement, autoimmune involvement. I mean, there's a lot of factors in fungus. I'm hoping the better medications that we're working on, you need to get the medication in the toenail. That's very, very important. So let's move to the next slide. And I'll tell you what the microdrilling does. Okay. Now, I first learned about the clear nail a couple of years ago with a Dr. Annette Joyce. She asked me to get involved in it. I like the idea of the microdrilling. It puts little holes in the nail so the topicals can get inside. There's no debridement with it. There's no side effects with it. The beauty is that what you have to understand is that when you put little holes in the nail, the topicals get in there, it does two things. And I'll make it real simple. We can get very scientific. One is it just allows evaporation of water and moisture. You just change the environment putting the holes in. And two is it works like an irrigation system. The medicine gets in there and it's a holding tank. You ever put a topical on it, it probably rolls right off. Some of it gets in, but it rolls right up. If it gets right in the nail and it stays in there, you're getting like a drip irrigation. And that's why I think it really, really works. I once talked to a Dr. Gupta who was involved with me. He's a pretty well-known dermatologist, and he feels it's the fact you're putting the holes in there and you're aerating it, and it's the alcohol that's in the antifungal. We typically use Lamisil spray, anything alcohol-based. And he felt it was the antiseptic of the alcohol getting in there in the nail that worked. You know, there's a lot of different ways, but the point is that if you're changing, next slide, if you're changing the dynamics of lots of water, you can change the slide, of a moist area, and you're drying it. I'm talking about inside the nail. That's going to kill fungus too. Fungus, you know, you turn it into a desert. So the drip irrigation is very, very important. You shouldn't debride it, okay? Because you want to maintain, you want to get the moisture out. They call it, you know, transionical water loss. You will get a quicker cosmetic result with microdrilling. It's about 1 millimeter in size now with the fibers. I mean, again, with the clear nail, and I can tell you about the clear nail. I found that the clear nail, and even the path former, which I worked with for a while, I found that the disposables are way too expensive. You're talking $20, $30 a disposable, and I got to tell you something. This is what I found out. Next slide. This is real important, and why I moved to there's a thing called impedance. They all have these what do you call it? Patents on impedance technology, but the drills all went only 1 millimeter, so it never went down to the nail plate. Excuse me, the nail plate, which is right before the nail bed. It never did that, and you know, I wondered. All the FDA clearances were they all went 1 millimeter, so you don't have to go that deep. All you're doing is putting little holes. And if you look at a nail, it's not solid under the outside of it. It's all soft if it's got fungus in there. So you just want to put little holes, and the fiber is bigger, so you don't have to put that many in there at all. And I found the repairs of these drills, they're a little difficult to use. With the Remy, the worst that can happen is with the handpiece gets replaced, which is under warranty, and you get 2 of them, so it doesn't really matter. You know, just switch it and you move on with it. So it's a lot easier to use. I did a lot of thinking about this. I got a little frustrated with some of these micro drills and the repair process. I don't like anything that I don't have control with repair. When I was with these other drills, they did the repair. They don't understand. You can't have a drill out of commission and take 2-3 weeks to get repaired. You need to keep it alive and fast. But the key is, and you can go to the next slide, is that and we go 1 millimeter. Now this is something interesting. This is something. See these little holes there? Okay, you can just do. You don't need as many. I'm going to show you pictures where you need a lot of holes. It shows a lot of holes. You don't need that many holes. You just want to put holes in there so that the medication can build like we call it a fire break. And you're lasering. This one was not lasered with fungus, and I mean with the actual laser there. But you could just laser the nail like you typically do, and then you put the little holes in there so that you're constantly using a topical in there, so you're stopping the advancement of the fungus, and you can get a good result with the fire break technique. And it's just a little bit of addition to it, a little bit. With a laser, you probably can get rid of this fungus, but you can absolutely get rid of it with the micro drilling and the fungus laser. And you have both. And it's not something that, you know, there's very little maintenance. It's just take the fiber out, put it in. There's no micro drill bit that you have to put in. You don't have to adjust it. You don't have to worry about that anymore. And they're all sterile, these little fibers, and they're a lot less cheaper. We're talking anywhere from $4 to $6, depends on the volume that you buy of them, these little fibers. Before, with the drill bits, they were close to $30. That's a lot of money. And plus, you can do the fibers. You can do warts, which we'll talk about. We do mosaic warts with no anesthetic with the same handpiece. So you can do micro drilling. You can do surgery with this fiber, cut out a wart with it, or you can do non-anesthetic. I have lots of videos to show this, but I'm not going to show it tonight. Next slide. Again, I'm mentioning the path. Sarah accidentally put the path former in here. I was right. I'm not taking it out. I want to show you where I've advanced into this. There's lots of studies show. There's lots of studies show that micro drilling works. How well it works, nobody really knows because it's fungus toenails. It definitely improves the outcome, and it helps topicals to penetrate much better. And you can combine it with the laser. I have, like I said, we've been doing this for a while, combining the micro drilling with the laser, and it seems that we don't have any double-blind randomized studies on it. They don't exist, really, to tell you the truth. It's very hard to do that. But micro drilling works. Next slide. The question is, how are you going to make the holes? And is it going to be cost effective to make the holes? This is some of the areas where micro drilling, I don't want to concentrate on it, but I've seen this work really well in patients, and it does work. I mean, it's not, I'm going to show you a study which shows that, it can be anywhere from 70, 80, 90%, depending on if you use oral. You can go next slide, oral Lamisil or not. Studies, I always say rip off 10% at least. This is just showing the old way of doing it. We had to change the bit. This is an old version of the path former. This is a case I did with one treatment. But just putting little holes in there. You see, if you look at the before, it's hollow in there. Yeah, you could debride it back, but if you put little holes in there and you put a topical, that's one treatment in a couple months. Look at the thickness and the result. You could go back and redo it again if you wanted. That was only 90 days post procedure. That's a bad nail. I don't think I can get rid of that with a laser. You can debride it all the way down, but the key is I believe that if you can get topical penetration that stays in the nail, it's going to absolutely help the outcome. How much? Nobody knows, but it's significant. Next slide. So how do we get through the nail? I mean, that's what pharmacology and pharmaceuticals have been talking about for years. Patients don't want their nail ripped off, a nail avulsion. I don't know if they even like it debrided, but that's another story. Some people are going to just debride it and not worry about keeping the nail and the fungus, and doing what I'm calling the micro drilling, where you're setting up an irrigation system. But it makes sense. Patients understand it. It improves the penetration. But I do think if you add the laser to it, even the little holes help to penetrate as well. But I personally think the fact you're putting little holes in there, you're allowing moisture to evaporate in there, and plus you're getting alcohol in your topicals. That helps a lot too. The reservoir effect is amazing. Next slide. And they do have lasers out there. This talks about the water balance. You put little holes in it, you're going to have evaporation. There's a big long scientific word for it, but it's basically evaporation. You want to dry it out. In fact, you'll see once you put the little holes in it and you put the topical with I strongly recommend at this point an alcohol base. We use Lamisil spray. Podiatry Tree has one that they made for us years ago, which you can buy through them. It will evaporate the. It has an alcohol base in it. It's
yeah, it's called Fortinia OS, David. So it's Fortinia, which is their standard antifungal topical. But the OS stands for oil-free, so it's the alcohol-based.
You don't want oil in there because you can clog up the little micro holes in there. You want evaporation, and you want the medicine to penetrate. Penetration is very important. I still think that the laser actually gets deeper because of the little holes, but I can't prove that. I know the results are a lot better, okay, and patients accept them more. I really don't think that just using a laser and as a monotherapy, you're going to get great results. I just don't think you will. And I've been around lasers. I mean, the Q Clear I helped develop, and we had it out there. It was the first portable one. Had a lot of maintenance. It was very expensive to maintain. This one thing about the Remy is if I died tomorrow, God forbid, you can get the Remy repaired anyway. We have all USA repaired service, and they're very experienced. It's very low. With the electronics today, it's very easy to repair a laser. Very, very quick. Very, very quick. It's not out for weeks and weeks and weeks. The Remy has very little repair problems. The hand pieces, it's possible. I've really worked with the hand pieces, but everybody gets two hand pieces. One goes down, you put another one in, and you move on. And that's important. And then you call me up and say, I need it fixed. I don't want you to cancel everybody in the waiting room because it's down. and it doesn't break. Well, we have the highest quality fibers in it. Yeah, if you run it over with a chair, it might break the fiber in there. It rarely happens though, but that's because I increased the thickness of it. Typical hand pieces fibers are 400. I went up to 600 microns. I don't want it to break, because I've been in an office where something breaks and you have the waiting room and you want to have it's full and you're backed up, and it causes, the headaches I'm talking about. You want it where if something goes wrong, you can put another handpiece in it, and that's typically what could go wrong is the handpiece. And we haven't had a lot of handpiece problems. We had them where they replaced, but they just put the other one in there and call me up and we replace it because it has a good warranty. Next slide. There's a lot of articles on microdrilling. The whole concept of microdrilling is what caught my eye. I think we're always evolving into the technique of doing it. I think there's a lot of work that has to be done with these computerized electrical drills. They're expensive. They're expensive. They're probably anywhere from $7,000 to $9,000 today, which is okay. But if it breaks, it's back to the. They're very technical. They're very technical. With the micro drilling, with the bare fiber, with the Remy, it's easy. It's easy and very easy. If something goes, again, you just put the new handpiece in. We haven't had these handpieces are very good. They don't break because there's no electronics, computers in it. It's just a standard handpiece, which you're going to see a picture of it. Next slide. Again, patients are going to be asking. They're going to ask for micro drilling and laser. They still ask for it. I personally I'm going to be around. I like pain because pain, they have it. It's typically gone the first visit. Fungus, toenails takes time to treat. I'll talk about different programs and different presentations of how to help, how to present this to your patients. But I found when you add the micro drilling, the results appear to look better sooner. But it's fungus toenail. I'm not a big fungus toenail person. If I had a choice between pain and fungus, you're going to get both with this. That's one thing that's nice about it. I would never just buy a laser that's just fungus, even if it's FDA clear. I wouldn't do that. So with the Remy, I'm trying to add things that you have more options to use. And we're going to have a lot more options with more times goes on. But right now, the fact that have the little teeny fiber, you put it in, it's sterile, you toss it away, and it's very inexpensive to do. It's fast, it's quick, and you don't have to worry about taking the handpiece off, changing it, putting it back on. It's very quick and fast. Next slide. Okay. Now this is an interesting thing. I don't know how you feel about the debridement and stuff like that. Some people won't do it. I don't think patients really love, nail dust all over the place. Just something to think about. We've had many discussions on PM News about it. I mean, I really, you have these vacuums and everything, which helps. I'm healthy. I never had a problem with nail dust, but it's patients read. They're on the internet. They read about nail dust. That's something you have to decide personally. I just thought I'd point it out to you. That was in September. There's a long discussion about 11/24/17. That's how long ago that was. Not that long, but it's a while. Next slide. This is just how it used to work. I can't use the videos. You had to hook electrodes up to it and drill it. It does work. How well it works. I mean, the studies are going to show, if you take, you can go to the next slide, they're going to show 92% improvement within 6 months with drilling oral Lamisil and topical. I don't know if it's that. One thing I've learned about studies they're hard to replicate, and they're very hard, but it definitely improves significantly enough for me to tell you have the option. I put the time in to give you that option of doing this, and it's part of the laser now. If you just bought the Remy for pain with all the options for pain, you can build your practice. I've always said that if I was in one room treating pain and you're in another room treating fungus, maybe not with the Remy, maybe with the Remy now, maybe more, but pain will build your practice. There's a lot of pain out there. It's $1 billion business in the world, billions. And you should, as a podiatrist, you should be part of it. You should be able to offer it, but you can only offer it if you have a laser that's reasonably priced. I would never buy a laser $40,000, $50,000 for pain. It just doesn't make sense at all. Okay, next slide. There's some more studies, microdrilling. You're going to get copies. You can look at the pictures if you want to later. Just examples. This was a study done by Gupta, who I talked to. I talked to the author one time. He was involved in this particular venture with us. Originally started the microdrilling with a Dr. Annette Joyce from Durham Foot, Dr. Gupta, and myself. I'm the only one left with the microdrilling, but I've moved it on because I don't like things that break, fall apart, and I can't control the maintenance or the service. I control all the service with the Remy. Believe me, the service is great. You'll get good service with me, I promise you. But we can continue. I'll just give you some highlights of it, and you can. This was a one study. It had a lot of. I mean, they had close to 100 patients. First group was the holes, oral and topical. I mean, you're talking. Look at 6 visits. Was once. They did one-time treatment, and that's another thing. You may be able to do less laser treatments. The typical laser treatment is 3 treatments every 30 days. With the drilling, in our mobile, we're doing 1 treatment, 1 drilling, and that's it. So it could cut down on the amount of treatments you need. But you can look at the results. This is group 2 was the holes in the topical. You're talking 73%, clear by the visit. I don't know if it's that high. I always said somewhere between, this study showed it was that high. But from my experience and your experience as podiatrists, it's anywhere between 50 and 70%. But I think you can get a little bit higher if you pick I'll show you how to pick the proper cases, what to do with it. If you think it's going to clear every nail, it's not. If you think it's 90%, it's not. I just don't understand why people say my laser does 90% successful. It does not do that. Next slide. But we're always working towards it. The cure rates, the cure rates are, the interesting thing with oral Amisil, I used a lot of oral Amisil in my career. It was good. I had 1 or 2 serious side effects where people were hospitalized. I never saw liver damage with it. But what I did notice was that the recurrence rate of fungus is so high. Okay, it's probably, I think it's like 50%, 25% the first year, and then within 5 years it's 50. I may be off of these numbers, but I mean, I had patients. Over 10 years, we'd give them multiple doses. It would come back. Can you imagine if you see the patient once you clear them up with a laser, even if you just used all Lamisil and you put the fire break in there that I talked about, the 4 holes, and start with a topical, you're going to get a better result. There's lots of combinations that we can talk about that get the results better, but you can't keep giving somebody oral medication every year. You just can't do it. But you could microdrill them and laser them once or twice a year to keep it from reoccurring. I've always said the beauty of a laser is to prevent the reoccurrence after you get rid of it, or combining. You could do combinations of what you're doing. There's nothing, and if you want to use oral Lamisil, can you imagine you reduce the amount tremendously? You don't have to give 90 days. You don't have to pulse it for 1 month and every other, 1 week on and 3 weeks off. 1 week will work. Okay, next slide. And you can read this study because you're going to get it. If you want a copy of it, I'll show it to you. Again, we don't like oil-based, no creams. It's intended to deliver topicals. If you have psoriasis, you can deliver steroids. You can even take an antibiotic. If you want to microdrill and have a bacterial infection, you could do that also and put a topical on there. But my point is that, it says right here, deliver antibiotics. And it's also, I believe, it opens up the moisture and drains the swamp. We all know what that means today. We've heard about it enough on TV. But putting the holes in there is going to change the moisture environment. Next slide. Okay, we can move on to this. I'll get to some other things. Okay, and this was, I'm sure you all know Tracy. What she basically proved was that laser therapy is not a monotherapy or single therapy, and I agree with her. It's not. There's no such thing as a laser that does it all. You have to add other things. You want to try to avoid orals, but some people might need them. You have the options to do this. I personally think that you shouldn't do the same protocol on everybody. You should customize it. Patients appreciate that, especially when it's out of pocket. An interesting thing. I'm in France right now talking to you, and I took my dog to the vet, and this is an interesting thing. I walk into the room, and there's a desk. He sits me down for 30 minutes and talks to us first before he examined us. If you could give that kind of care out there where you sit down and talk to them, not run in, run out, room. You can do very well. I mean, you can make yourself more valuable. I appreciate the fact he sat down and talked to me and got to know me. Once had a college roommate in podiatry school. He did that also. He still does it to this day. New patient comes in, they go into his office, they sit down with him, and he's very successful. Very little insurance, and in New Jersey, a lot of insurance in New Jersey, but he sits down and talks to the patient and then brings him into the treatment room, which I kind of like that. You got to be different today. You know, you can have great modalities, which I believe the Remy is, but change your little modus operandum a little bit. Try to think out of the box, which I like to help you with. Next slide. Okay, again, I believe the combination, the micro drilling and the laser definitely increases outcomes. Definitely, and the literature supports that, but it's got to be cost effective to you and to the patient. Next slide. This is a picture of the Remy. This is a 30 watt, it's 4 pounds. It's all FDA cleared, fungus surgery, non-surgical, warts, micro drilling, everything you think of. It's on there. I took the time and did that. It's very light. It can be moved around. I don't like the 4, but I like the 2 wavelengths, the 980 and the 810. If you want a 4-wave, fine. It's the same price, but I don't recommend it at all. And it's because each wavelength is 9 watts. I like 15 watts per wavelength because you have more more opportunity to adjust it. Next slide. Okay, and this is at the bottom. These are the therapy handpieces. That's just a picture of a surgical on the end, but that's the micro drilling handpiece right now. You just detach it. It's very light, and there's the bare fiber. It's hard to see in these pictures. I will tell you one thing. We will have probably another one coming out where all you do is you can snap on and snap off the handpiece instead of taking the cord off, and that's included with it. I've seen the prototype of it. You don't even have to have a cord. You just snap it on. But this is the one I like right now because it's also a backup for therapy too. You can use it for therapy, this handpiece. Okay, next, and these are all the indications, which I'm sure you know. Anything as inflammation. These are, if you want to use the presets in there, you can. It's got a full body. Just press buttons. I like my own protocols, which I teach you to use, but you can use the ones that come with it. They're all have been approved by the North American Laser Society. They're pretty standard, but I like a few ones that I know that work well. They all work well and the same if you know how to use a laser. And that's what I want to teach. I like to teach you principles of what you're trying to do, and it doesn't matter what what protocols you use, but I like you to start out with the one that I know that works and get good results right away. Next slide. Again, I formed Zuckerman Future Technologies. My goal is to bring future technology to you today. The Remy's, it's been out close to 2 years now. And it's a lot cheaper. I'll even tell you the price. It ranges anywhere from $9,500 to $14,500. All the Remy lasers they have different powers with it. But the best one that I have right now with all the multiple wavelengths is the 30 watt. You cannot buy a 30 watt laser today for this price. It doesn't exist. We're importers. There's no salesman. It's just me, and I have a few of my friends that are involved in it. But without a middleman, if you're talking to a salesperson who's selling you a laser, talking about a laser, he's got a nice commission. And I'm removing that commission because I want you to have the benefit of it. I mean, my goal right now is so you have a laser in your office. It's multifunction. It's top quality. I'll put this laser up against anyone. The quality is there. It's just I don't have a salesman they have to pay a lot of money for. Okay, next slide. This is the turnkey. One of the things that we can talk about is, and Sarah will talk very briefly, we have a market. It's very important. Basic marketing is very important, and Sarah's been amazing at it. She's going to talk about the marketing next that comes with it very briefly.
Yep, thanks, David. So as you can see here, these are just a couple of images of advertisements and appointment cards and postcards and brochures and in-office posters that are a part of your marketing toolkit. And when you purchase the Remy laser, we'll send you a link with all of the different tools that are included. And you can choose as few or as many of the tools that we provide. Some people really like to continue to place newspaper advertisements, so we have templates for that. We always recommend that you use your in-office marketing tools because internal marketing is the best ROI for any marketing expense. Lucky for you guys, you don't really have any marketing expense when it comes to these. There's a very small printing, but we always give you really good rates on printing as well. But all of these, the marketing tools themselves are done for you, and that's just an additional benefit that David throws in so that you can start to receive ROI on your investment immediately. And so what you'll see, you'll work with me personally. I'll get your logo from you. I'll get your corporate colors from you. And we will make sure that your individual products and your individual communication pieces match your current brand so that your patients aren't confused about where all of these materials are coming from. So it's just some great added value that David has put into your turnkey laser toolkit. So again, you can start seeing revenue right away with your patient education and awareness tools.
And one thing, thanks to Sarah. Sarah is very involved. I mean, she's strictly a podiatric, marketing company, and she's got lots of experience in it. She's developed pain and inflammation videos that hook right in your computer in individual rooms, and for fungus and for pain. So there's a lot we can do for you to get you started. Next slide.
One of the things, I don't have images here, and I do apologize. You can see these images that you're seeing in front of you are the templates for the pain laser, the laser element of the equipment. But because David and I had worked together over the last 3 years, I was with him when he was working with Clear Nail. I was with him when he was working with Passformer. So we have materials ready to rock and roll for micro drilling marketing. So again, these are things that we're ready to turn out to you right away as soon as you purchase.
Okay, next slide. And then we have a surprise for you. A present is that typically the Remy is a 2-year warranty. For anybody that attended this webinar before the end of the year, we're extending it to 5 years at no additional charge. I mean, 5 years is a long time. And that's what I do, that to show you the confidence I have in this laser, which is important. And I know the track record of it because I know it now. I know, and it's very good track record. Very, very minor problems with this, and they're very easy to be fixed right now because most of the stuff can be adjusted very easily. We have I have a center, a repair service in the United States. Guy's an expert at it. He's been with me for years. We're not a new company. I'm just at the point where I've learned so much over the over the years from a lot of different mentors and a lot of different companies. And I finally put this together because, again, it meets 3 things. One is it's got to work. 2, it's got to be affordable to the patient, and you want to be able to you should be able to make a profit on it. I mean, you need to make a profit. There's nothing to be ashamed of to make a profit as long as it's effective and you're treating your patients right. I do want to thank everybody. If there's any questions, just feel to ask. Oh, and this is the contact information. Again, this is the Remy. It's my Yorkie. Just show you the size. It's a 4-pound Yorkie. That's the size of it. You can pick it up. It's interesting for women. I have some women don't like it. Has a shockproof case, but I have some women that don't like the shockproof case. They have a bag. They just stick it in their bag, and nobody even knows that they're carrying anything. It's light. It's a light, easy laser to use, but very powerful. This dog doesn't bite, so he's not that ferocious. Okay, I think that's it. I appreciate everybody for taking the time to listen to this tonight. I hope I can help you, and I hope I can advance you into the Remy laser world. Thank you very much.